Toye. We start off with developments in the health sector, where the National Association of Nigerian Nurses and Midwives has suspended its 7-day nationwide warning strike after days of disrupted health services across the country. At a briefing by the leadership of the association, the national president, Haruna Maman, says the decision followed a virtual emergency meeting of the association's National Executive Council earlier today. Nurses had embarked on the strike on Wednesday over poor remuneration, staff shortages, unpaid allowances, and unsafe working conditions. Following a review of a signed memorandum of understanding, the NEC resolved to suspend the strike, citing government's commitment to meeting its 9 key demands. The association says it will continue to monitor government's compliance with the agreement, reaffirming its commitment to defending the welfare and rights of nurses and midwives across the country.
The decision was reached after an emergency virtual meeting of the National Executive Council on 2nd August 2022, where a signed memorandum of understanding was reviewed. The federal government has committed to a time-bound implementation of all 9 key demands presented by the association. In view of this development, NEC has directed the immediate suspension of the strike action in line with the principles of dialogue and good faith. NAM expressed appreciation to its members nationwide for their unity, patience, and resilience.
I told you earlier that the National Association of Nigerian Nurses and Midwives have now suspended their strike. Let's bring in second Vice National President of the association, Sheson Orolu. Mr. Orolu, thank you for joining us on the news this hour. Walk us through the specific promises that government made in the MOU that convinced the association to suspend the strike.
Once again, good evening, my presenter. Good evening, Nigerians. And I want to salute the courage of all the Nigerian nurses and midwives in their collective struggle aimed at achieving our demands. For a week long now, we've been on this issue, and we have been having a series of dialogue and meetings with all stakeholders, the Office of Head of Service, the Ministry of Health, Ministry of Labor and Productivity. I want to tell you this evening that when there's an adage that says, when somebody asks from you, what is the value of what is in your hand, it is left for you to say you have something that is valuable in your hand. And that is what we have just demonstrated in the last 3 or 4 days during the warning strike. And like we rightly demonstrated, we have shown to the whole world that nurses are very unique. We made our demands, and some of these demands has to do with gazetting the scheme of service. And most very important is the upward review of our professional allowances. And I want to tell you today, following series of dialogue and meetings that we had with the various stakeholders, the government has been able to meet some of these our demands. And this includes having to meet some of these demands, like the gazetting of our scheme of service. Like many people are not really aware what this gazetting means. I want to tell you this evening that the scheme of service is a formal document that outlined, structured, and shows the qualification and career progression of nurses. Now, if this is approved and not implemented, then government has not been able to do anything. But with the dialogue we have been able to make with the government has promised the entire nurses of this country that in less than 4 weeks to come, that they are going to implement the scheme of service. And most importantly, I want to tell you this evening that what brings joy to the nurses is their welfare. This welfare has to do with upward review of our professional allowances in the area of shift, in the area of call, in the area of uniform, in the area of hazard. These are some of the allowances we are asking for. And with the meeting we had with the government, they are saying that this will be reviewed and be implemented.
And then, Mr.
Thank you.
Orolo, how soon exactly should Nigerians expect normal healthcare services to fully resume?
Yes, like you know, nurses are always at the forefront of healthcare services. And in the last 3 or 4 days now, the healthcare sector has been solely paralyzed because of the absence of nurses in their various duty posts. And I want to assure you today, because government has been able to meet part of our demands, we have had a resolution that the strike should be suspended, and we are going back to our duty post by the grace of God.
Well, good place to leave it. Sheson Orolo is second Vice National President of the Association of Nigerian Nurses and Midwives. Thank you so much for talking to us.
Thank you. Nice